Thank you, Dr. Kaushik. Actually, I took a legal aspect as a time pass during COVID. And in sitting in this hall, I feel like watching a horror movie. I attended all the other halls. We were all relaxing, talking about something, looking at WhatsApp. Here, everyone is very... so this is the final slides that will... Anyway, all of us know that we will be liable if we make a cluster endophthalmitis. There are plenty of avenues by which you can be sued, or patient can go take a criminal, give a criminal case against you in the police. They can go to the medical council. They can go to consumer protection, consumer court. They can go to civil case. They can give a civil case. All these are possible. If we don't mind about all this, that comes later. We can somehow deal with. But the initial part is the most important thing in a cluster endophthalmitis. So there is something called medical negligence, which is defined by Jacob Matthew versus State of Punjab. It should be some breach of duty caused by omission to do something or doing something which a prudent or reasonable man will never do. So there is something called negligence. None of the doctors, none of us will try to destroy the vision of a patient. That has to be very clear. So if you give a standard of care, most of the court of law will leave you. Because I went through all the endophthalmitis Supreme Court and High Court orders and everything. And 98% is in favor of the doctors. Only 2% is this thing is against the doctors because of some very bad omissions in the records and other things, or management. So 98%, the court and the law is with us. So that is one thing. Now, having said that, there are a lot of other things involved in a cluster endophthalmitis. We have a bad outcome. It is not our fault actually. Like Supreme Court has said, a bad outcome of a surgery is not the fault of the doctor. It is possible if you have taken a proper consent that already we have mentioned. So in a case of medical negligence, they assess, they apply what is called Bolam's law, Bolam's test it is called. So first of all, there should be a standard of practice in cluster, like Vision 2020 or AIOS has given a standard practice. Just are you sticking to that or are you deviating from that? Second, the defender has not adopted that policy, that there is gross omissions in the practice. And that has resulted in something that the doctor did which is not standard of care. So these three things are there that should be there to prove that you are negligent. So like I said, standard of care is there. Like the patient comes, then you have to do all these things as the MPS are told, vitreous stab, intraocular injection, vitrectomy, all the things we have done as per this, and it is recorded properly in the in the hospital. So that part is taken care of. Now, the consent is extremely important. What happens in many places, in camp cases, they give a blanket consent. Like just sign here, they will sign, and some fill something. This consent has no legal value. Ideally, at least it should be written that I have read in the patient's handwriting, I have read the above things and understood, and at least that line should be there. Many times it is blanket consent, especially in high volume camps. So Supreme Court has said that also, that you should have a proper consent which is legally valid. And another thing is, RDO sir has gone. Yeah, there is camp cases are not, camp cases does not mean there is no compensation. Camp cases are included in compensation because ideally free treatment means free treatment to everyone. If you charge few people, if you don't charge few people, it is not free. So in that case, make sure, understand that camp cases are also liable for compensations. And as I said, there are a lot of cases in Supreme Court and which has ruled in favor of the doctors if you provide a proper treatment. Can criminal proceedings be taken against ophthalmologists after cluster endophthalmitis? This is very, very gray area sort of thing. Ideally, if you apply section IPC 304A and 304, that there should be a death. In cluster endophthalmitis, there is no death actually. So 304A cannot be applied. But there are something like 3337, 338 and all, where there is a grievous hurt, loss of vision is there. So in these things can be applied by the police, but it is not amounting to for criminal negligence and arrest. Usually this should not. So, but there are other problems. In Jacob Matthew case, Supreme Court has said there should be severe recklessness and disregard to the safety of the others. And there should be a mens rea, which will not be there in a doctor's case, in a case of endophthalmitis. So, Indian Penal Code 1860, which is going to be changed to Bharatiya Nyaya Samhita from June, has lot of sections, and in section 176, it is mentioned that death on operation table should be informed. And it is advisable to mention unexpected rare complications to the police. So this is a gray area. I will talk about that later. And 304 and 304A usually cannot be applied unless it is a death. We have seen that also by anesthesia complications and all. So 319, 320, 338 is usually given. Now, there are other Supreme Court guidelines like Kusum Sharma versus Batra Hospital, all these things. They mention that a professional doctor is not negligent merely because of a complication or a difference in opinion or something like that. So they should not be harassed. This also is a verdict that can be quoted by many of us. Now, suppose a patient's relative files a case against you, like group of patients files a case. The police can come to the hospital and they will do an initial investigation, and then they will write an FIR. It is written by police, first information report. Based on that, they can do whatever they want. So if they think that there is a big problem, and they can seal the hospital at least. Even if they don't arrest you because there is no death in this, they can seal the hospital so that you don't tamper with the. There are different government orders in Kerala also. It says that they should form a committee of collector and the DMO, district medical officer, and experts, and based on the report, police should take another criminal case or not. So this is ideal thing, but this does not happen always, because many times if the police want to harass the doctor based on the pressure of media and politicians, so they can do it. They can arrest the doctor on Friday evening. But if such a thing is happening, you can always take an anticipatory bail, and so that you don't go to that extent. Always take an opinion of your proper lawyer, good lawyer, not this thing. So procedure for bail, I don't have time to. So do's and don'ts, I have already told. Don't panic, but I will also panic. That is different. Don't manipulate and tamper. Somebody you can, in the hospital, your team, one person can look after the documents completely. You can't do everything. So one person can look. Don't do unlawful things, unethical acts, like and don't neglect treatment. MPs are told that proper treatment. In the panic, this thing, don't neglect treatment. Inform police whenever necessary if such an inquiry is there. Extend all cooperation to the police. All these things, preserve documents, and probably help of your local IMA or all AIOS or Vision 2020 or somebody. And Justice Markandeya Kadju has clearly said, court must refer complaints of medical negligence to competent doctor or panel expert. It is necessary to avoid harassment to doctors who may not be ultimately found to be negligent. So they should not harass doctors. This is a landmark judgment by Markandeya Kadju. But in real life scenario, is this what is happening? I don't think, because police with the pressure, first people who come inside will be the channel people, so that they will come and interview the doctor, and by the time there will be problem, and then police will come and arrest the doctor. So this is happening first time. But unfortunately, there is I don't have any answer, but to how to tackle all these things. These are some of the outlines I can just say. Probably we should have a proper legal opinion. You should have a legal advisor. All these things you should have. And the CAM cases is not very simple. Actually, most of the complications and procedures are happening in CAM cases. And free doesn't mean that you are not responsible for the outcome. Most of the problems are coming in CAM cases. So these few things I will wind up. Thank you.